Hey, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Thank you for tuning in for video 2 of our series for shoulder pain. If you're here, you most likely have seen video 1, or this has been forwarded to you by a friend to kind of check it out and see what's going on. So in video 1, if you haven't watched that yet, really important that you go back and watch that, because that's going to start going over some of the causes of shoulder pain, some of the more common causes of shoulder pain. Certainly not a complete list, certainly not everything that could be going on with your body, but it goes over some of the basics of what shoulder pain could be doing, what could be going on in your shoulder. So now we're going to go over kind of how you can look at it at home, what you can do to kind of test things out on your own to see what it is, and go from there. So one of the things that I do want to say is, there's a lot of false positives out there. And if you think something is there, it's going to be there. And what I mean by that is, if I look for something, I'm going to find it. Okay, so if I go in to an appointment or I go in to see a patient and I have a preconceived notion that this patient has a rotator cuff tear, I can generally get a test to be positive. It may or may not be positive, and I can kind of, be able to convince myself that there is one. So what I tell people, what I tell students, what I tell people that I teach is, if it is not definitively there, it's not there. Okay, so let's say you have pain in your shoulder at all times. Like just sitting here, you have pain. Okay, you're going to have pain with every single test that I show you how to do. All right, it is not going to be, oh my gosh, I have all 3 of these things because I can't move my arm without pain. So if you can't move your arm in any direction right now without pain, all 3 of the things we're going to go through today, you're going to be positive for. And if you have pain with your shoulder at all times, there's something going on that you need to get checked out. This is a little bit above a home remedy. But when you're looking for a test, or when you're doing a test, you want to make sure that when you get a result, it is a positive result. So if I'm looking for pain when I do a test, I don't want to, split hairs. So if I do a test and someone says to me, I think it kind of hurt, kind of, yeah, I guess maybe if you did it on the other side, it would hurt too, right? I don't know. That's not a positive test, okay? What we do with these tests should light your shoulder pain up. So when we do a test, and this is the shoulder, this is the back, or whatever, it should be a definitive, ow. Okay, that hurts, don't ever do that again. If you find that you are talking yourself into pain, or you're talking yourself into a positive test, you don't have what's going on. Okay, so just be aware, it's a very common practice. When people come in and they say, oh, I did this on the internet and I found this and this and this, it's not always the case, and it's not always positive. A lot of times it's either 1, you have shoulder pain before you ever moved into that test, and 2, you were kind of on the fence, maybe not really, it kind of hurt, yes, no, I don't know, okay, no, it should be a definitive yes, okay? So don't talk yourself into anything. And if you are convinced that you have a rotator cuff tear, like, the mind is a powerful thing. So I know people like to come in and tell me they have a rotator cuff tear, and if they are convinced of that, there's nothing I'm going to do to change their mind, okay? Same thing you're going to do when you test. So when I show you a test for the rotator cuff tear, and you think you have a rotator cuff tear, I guarantee you it's going to be positive, okay? Because you're going to convince yourself of that. Try and step back, take yourself out of your shoes, your own shoes, and say, okay, does this really hurt? Did this really light me up? The answer is no. Probably not a rotator cuff tear. So with the shoulder, a lot of things in order to be definitive, and a lot of things in order to really get an accurate diagnosis, you are going to need, an imaging study, or someone with some medical expertise to kind of just do a couple of quick tests to make sure and see what's going on. But we can go over a couple things that you can just start off doing at home to see kind of where you're at. So the first one is impingement. So shoulder impingement is really, really common. It's common in a lot of overhead athletes. So if you were a baseball player, volleyball player, swimmer growing up, this is a very common thing to have. And if you weren't, it's still a common thing to have. So what happens is you have the bone on the top of your shoulder, and the bone right here, okay? So every time your shoulder moves, all right, and there's a gap in between these two. So here's your bone, here's a little gap. So every time you move your shoulder, that gap closes, okay? It should not close completely, but it gets smaller, okay? And then as you go down, it gets bigger, it gets smaller, it gets bigger, it gets smaller, it gets bigger. Well, over time, what happens is that sometimes this bone grows a little bit more into the space. It grows downward, grows a little bit more, so it condenses that space a little bit. And then, if your muscles are not balanced correctly, meaning like these upper traps are pulling harder than things like your scapular depressors, or your muscles that are supposed to keep your arm and everything in place, what happens is that gap gets closed and even pinched off, okay? So every time you move your arm in a certain position, you're going to get a pinch. You're going to feel impingement, all right? Now, I'm going to tell you, if you have numbness and tingling in your fingers, it is not impingement. There is something going on. Now, as I've said before, you may have three things going on. You know, this is not, generally what I see is not a clear cut, like, oh, yep, that's impingement. You know, we can have impingement, we can have herniated discs, we can have all muscle guarding, we have a potpourri of things going on. So it's very rare for people just to have one thing going on. But I want to give you a heads up. A lot of times people think impingement, okay, I have numbness and tingling, that's impingement. Not in the definition of impingement, okay? So if you have impingement, you have an issue with your arm, you have some pain, that could be impingement, numbness and tingling. We're not thinking impingement, that's another thing entirely, okay? So if you do this test and you wind up getting numbness and tingling, we got something else going on. So what happens is this little gap closes, okay? Once this gap is closing, it's irritating muscles that are going through there, okay? You're starting to get some pain, okay? Starting to become impingement. So what you can do is you can slowly bring your arm across, turning it in, okay? Just like this, nice and easy. Now, I'm going to say that doesn't feel great. Now, I was a swimmer, so yes, I have some issues in my shoulder already. Does not feel comfortable, okay? Ideally, if you can get someone to hold your arm, and you do this and just let your arm hang, that's going to give you a better test, all right? Do I have pain with that? Kind of. Do I have discomfort? Yes. Okay? So, do I have really impingement? When I diagnose myself with impingement, there might be some impingement symptoms going on. Is it pure impingement? No. Okay? So, that's kind of one of the ways that you have to really look at this, is that if I, you know, when I do this to someone with impingement, I get about this far and they're like, boom, like, you need to stop the test. It's over. Okay? It really, really hurts when you do that. You're closing off the space, you're impinging everything, it's going to hurt. Okay? It's going to hurt a lot. It's not going to be, you know, I have a high tolerance of pain. It really, I don't know if it hurts. No, it'll hurt. So, and for impingement, you know, in the next video, we're going to go through a couple things that you're going to be able to do at home to kind of start correcting that impingement. The next is the rotator cuff tear, okay? Very, very, very common. And as we progress in medicine, we are finding that doing a surgery for every rotator cuff tear is not the way to go. And actually, most of our patients that have small rotator cuff tears are actually getting 100% better without surgery. So, you know, you normally, back in the past, especially when I got out of school, you heard the word rotator cuff tear, that person was carted off to surgery, no questions asked. Now we're seeing the surgeons are really taking a look at how big the tear is. And if it's not really that big, they're going to send you for physical therapy. And 100% of the time, if it's not a big tear, we can get you back pain-free, motion, everything like that. So, you know, I'm going to show you a test here, kind of see like if, you know, a rotator cuff tear is possibly in play. That's an MRI definitive test. You know, they will show up on an MRI if you have one. Now I know insurance companies are cracking down on who can get an MRI, and a lot of times they make you do physical therapy first before you get an MRI. What I would tell people in terms of that is whether you have a cuff tear or you don't, you know, the rehab is going to be the same basically. So it's not like we're going to do something that's going to tear your rotator cuff, you know, further. If you come into therapy and you already have a cuff tear and you're contemplating surgery, you know, the stronger you go into surgery, the stronger you're going to come out of surgery. But you want to make sure that you are making the correct choice in terms of, you know, knowing and understanding everything that goes on with the rotator cuff rehab, okay, post-surgery, because it's not easy. So, you know, we try and just kind of give you all the facts and figures up front. So for a rotator cuff, all you're going to do is take your palm, take your shoulder, stand up nice straight, thumb up, turn it down, okay? You're not going to go straight out in front. You're not going to go straight out to the side. You're going to go halfway in the middle, okay? You're going to lower, or you're going to raise your arm up with your thumb pointing down, okay? And then you're going to resist, okay? Or you're going to have somebody else try and push your arm down. If you have a cuff tear, okay, or a suspected cuff tear, you're going to light up like that. Okay, you're just going to go, ow, be done with it. All right, I've seen enough to know the reaction. It's just like a complete crumble. I can't hold it anymore. Now, if you don't test positive, does that mean there's no cuff tear? No, there's other tests that we can do in order to see if there's a cuff tear. So another test that we can do is a subscat test. So what you want to do is, again, make sure you're standing up nice and straight or sitting up nice and straight for these. If you're like this, you're going to get false positives galore. Put your hand behind your back. First of all, if you can't do this, there's a problem, all right? Probably the number one reason men come to see me about their shoulder is they can't get their pen to get their wallets, okay? Women, they can't get their bra done. So if you have problems even getting into this position, there's something going on that needs to be treated, all right? And it's far beyond a home exercise program. If this bothers you, it's only going to get worse from there, okay? So you really need to understand that this is the number one position people come to see me for when they have problems with this. So if you can't get your arm back there, number one thing, you've got something going on. What you want to do is you want to try and lift your arm away from your back, okay? A lot of times when people do this, you know, if they're in the proper position and they're sitting up straight, it's going to do this. And you're going to lift it up and it's going to do this, okay? And you physically can't hold it. And then if you actually try to bring your other arm back and push, you wouldn't be able to hold it, okay? Now you should be able to, if you push against your hand, you should be able to hold it out there, okay? Or if somebody else comes and pushes against your hand, you should be able to hold it, okay? So a positive subscapularis test is either you can't lift it off, and like it literally snaps back, you have pain even bringing it back, or when you hold it out like this, you can't resist it. You can't resist any pressure. Again, something's going on. Could it be a cuff tear? Yes. Could it be something else? Yes. But it's an indication of a positive test for something going on. Okay? So are we suspecting tear? Maybe. But it's something that you need to get further investigated, especially if you're already experiencing symptoms like pain, numbness, and tingling. These are things that, you know, you kind of have to look at and say, okay, you know, this is something you got to attack. And the final thing is tendonitis. Lots of shoulder tendonitis out there. And when I say tendonitis, I'm literally just lumped like 20 muscles into one group. So, you know, we see a lot of tendonitis. Biceps tendonitis, big one, okay? So we're going to show you kind of how to test for that because it's one of the more popular ones we see, but it's not. Tendonitis of the shoulder does not mean biceps tendonitis. There are other muscles in the shoulder that we could have a tendonitis on. Tendonitis is an ache, all right? It's usually a pain, specific movement. You know, you have problems, you know, lifting your arm overhead. You know, go right here in front of your shoulder and push. Does it hurt? You know, yeah, actually, yes, it does a lot. You know, if you're like, I don't know if it really hurts, it kind of feels like you're rubbing, but I think if you push this hard on the other side, no. If you're pushing as hard as you can and it hurts, that's not normal. Try the other side. You're going to see it feels differently. You should just feel like your fingers are in your shoulder, okay? Again, if you do this and it hurts, it's an indication that there's some tendonitis going on. Another thing you can do is raise your arm up, okay? and either you or somebody else, try and push your arm down. If it really starts to hurt right there, it's an indication that there's tendonitis. My kind of heads up on tendonitis is that if you have tendonitis, it's an indication that there's something more going on. Why is that muscle inflamed? That's what you have to get to the bottom of. You know, when you go and if you actively begin to treat this, what you want to be aware of is what's going on. You know, why do I have tendonitis? Your muscle just doesn't get inflamed because it gets inflamed. You know, your muscle gets inflamed because there's something going on. So, you know, make sure that you're, you know, really finding the cause of that tendonitis. Tendonitis, while it's a very popular shoulder diagnosis, is secondary to something else going on. Is it weakness? Is it muscle imbalance? Is it just repetitive motion? Whatever it is, you got to figure out why it's going on. You know, so we'd love to give you a free phone consultation. You know, you can sign up for that here in the email, or if you reply back and let us know your story and kind of how we can help, or if you have any questions. This is a lot. This is a lot of information. There's a lot of years of schooling that I had to go through that, you know, it does take some time to figure it all out. And it can be confusing and it can be overwhelming. And we just want to kind of help you over that overwhelming hump or over that scared hump. Or am I going to need surgery? I'm not going in because I think I'm going to need surgery. You know, set up a time for us to talk to you. We'll be glad to do so. Reply to this email. We'll be glad to respond back to you, let you know what's going on. We have shoulder experts on staff that know how to treat this, have seen these things more than, you know, more than a dozen times, more than 1,000 times, I know personally. So, you know, they'll be able to tell you what to look for, you know, and even just talking to you over the phone, we'll be able to kind of hash through some things in order to get you feeling better. So video 3 is going to be coming up in the next couple of days. We're going to go through kind of what you can do at home to treat some of these common shoulder problems.